Hello, everybody, and welcome to today's webinar. My name is Sabrina McCarley, and I will be the moderator. Before I turn this over to Kevin Christensen and for Stephen Hunter to introduce him, I would like to cover a few housekeeping reminders with all of you. All attendees are on mute. The handouts were provided to all of you in the email that you should have gotten. It comes out about an hour ago, 65 minutes ago, that you should have gotten. If you do have any questions for Kevin, we ask that you put them in the Q&A and we will get to those at the end. If you have any technical issues for Christy, because I'm not going to pretend that I fix those, but for Christy, please put those in the chat. And then the recording will be emailed to all registered attendees approximately 48 after we conclude, and will be available in the NARA member portal within 24 hours. So with that, Stephen, I'm going to hand it over to you to introduce Kevin.
Hey, thanks, Sabrina. And thanks for attending. I think you'll find this extremely valuable. So as you can see from this slide, Kevin is an occupational therapist, graduated from the University of Utah with a master's degree in occupational therapy in 2013, and then went to work for the state of Utah as a assistive technology specialist. And you know, from what I understand, they called Kevin MacGyver when he worked for the state of Utah, because he could fix and adapt anything to help patients. We were fortunate to bring Kevin over to Intermountain Healthcare in 2020 to work on my team, which is the internal process control team with Intermountain. And Kevin was specifically hired to help us become more efficient with the use of technology and to take us to another level of providing virtual and telehealth services, which Kevin has done, and he'll probably talk and give you some examples of some of the work he's done in that area. I just want to say that bringing Kevin on in an era where all of us are having reduced reimbursement, at least at Intermountain, has really helped us increase our efficiency, both our caregivers as well as our managers and directors. And so if you just take some of his ideas, which are really minimal cost or no cost to improve your efficiency, it's well worth it. And again, when we can't change our reimbursement very well, we can improve our efficiency. And I think Kevin will share some great tips for you to do that, because it's made an amazing difference here at Intermountain Healthcare. So with nothing else to say, but this is a great opportunity for us to learn from Kevin. I'm going to turn it over to Kevin and go off camera and let Kevin take it away.
Awesome. Thank you, Stephen. And I'm really excited to be able to be here and to talk to NARA Nation. NARA is one of my favorite organizations to be connected with, just the people. So I was trying to add some photos last minute. This is me and my family. If you know me as Stephen and others, I'm a big fan of rugby. I was going to add some pictures of when Stephen and I went and did the subway and other canyoneering stuff. But anyways, I'm excited to be here, and thank you for that wonderful introduction. Technology is something that I'm very passionate about. It's something that I love talking about. And today, I hope that what you get out of this presentation is not necessarily specific technology that you need to start adopting, but more of how we determine, how we came to utilize some certain technologies, how that may apply to your area and your setting, and how you might go about exploring and finding technology that will work to do all these wonderful things, right? I sing the praises of technology all the time. I think it can improve efficiency, it can engage people, your caregivers, your patients, and really enhance the service that you provide. And it's really, it's taken off. I mean, we'll talk in a little bit. There's some exciting technology coming out. So I love the opportunity in the position that I get to be in here at Intermountain Health, and that I get to be on Stephen Hunter's team. So first, before I talk about any technology, I want to talk about our relationship with technology and all the changes and wonderful opportunities that we have. Now, you may not all be like me who loves technology. I inherently am drawn towards technology. I love playing with it. I find it to be, highly efficient, engaging, enhancing. I view the positive side of technology, and I see it through that lens. However, I understand and can appreciate that not everyone sees technology in this way. They or some see changes or new technology as cumbersome, frustrating, and limiting. And it's not, to a certain point, it's not necessarily technology. Technology can be better made, it can be easier to use than other technologies, but it's not necessarily the technology's fault. And that's what I want to highlight and talk about here. It's really how we're utilizing, applying, and leveraging the tools that we have, where I often see more of that right side there. So, kind of be thinking about who are going to be your end users and what is their perception of technology. If you're someone like me, you think that everyone's going to love adopting the latest and greatest new technology and have no problem because you sing its praises. However, realize there are probably a fair few who see technology as a threat, something that's going, and if you're a Star Trek fan, you know who the Borg is, and that they will come and assimilate you against your will. So understanding people's relationship with technology varies and is different. Maybe yours is good, maybe it's bad, but stick with me here, and I want to talk about what you can do to combat that, or what I'm putting here in this slide. These are more of my, when I'm adopting new technology, the golden rules that I try to stick to. Now, that doesn't mean that I do this every time, but these are the things that I try to stick to, and I know that I'm going to be more successful. So whenever I adapt any new technology in my role here at Intermountain, first and foremost, you really got to understand the problem before you apply the technology. And this was a lesson that I learned early on in my career. So as Stephen mentioned, I spent the first 7 years of my career as an OT working in the community at our state tech program. And you learn quickly on, you can't just throw technology at problems. Even if you think you understand the tech, and a lot of times you would hear from vendors or others that, this technology solves this problem, or this technology is the universal solution for this issue. And if you get into that rut, you really run afoul of being efficient, and you land more towards that right side where things become inefficient. I love, there's a quote, and I'm totally going to butcher it, but from Albert Einstein: if he had 60 minutes to save the world, he would spend 59 minutes framing the problem, and then 1 minute actually solving it. And really, there's a lot of truth to that. Is you've got to look at what problems do you have, what problems are you trying to solve before you even start considering any technology. And it's hard because you'll have vendors that are coming and they're showing you all the cool things that their technology can do, and saying, hey, this will fix a problem that you didn't even know you had. Avoid doing that. Really take the time to stop, pause, and frame what issues are you facing in your clinic, in your hospital, and it'll only serve, when you start looking at technology, to really help inform and make sure that you find the right and appropriate solution. Number two is you've got to provide support. You can't just think that everyone is, once you have the tool or technology out there, that all your problems are solved and it's great. Some people like me love it and will probably run with it. Others not so much, and they're going to need continued support, tweaking. And that leads right into the third thing that I always try to remember, that technology is not the solution. It's really just a tool that helps the people and those that are doing the work to solve the problem that you've identified. I think I and others get caught into this, hey, technology solves all our problems, or technology is, does this wonderful thing. And really, we need to remember that it's a tool that's leveraged by the people and those that are actually doing it. So those are kind of my golden rules, or things that I try to remember and not run afoul of. So with those in mind, I want to talk in today's presentation about 4 types of categories or technologies that we've adopted here at Intermountain Health since I started 3.5 years ago. And so I think these are good examples. The first 2 that I'm going to share, we've been able to leverage, implement, and I have good data that shows what we've been able to accomplish by leveraging these technologies and going through the process. The last two, we're still trying to figure things out, and I think there's good lessons to be learned there. So, keeping all that in mind, we try to leverage these tools in a way that involves the care providers, the patients, and it is done in a collaborative way, and not in a way that forces the solution or our ideas upon others. And if you get this movie reference from this GIF, bonus points to you. So we'll talk about a technology loan library, Power Automate Microsoft Forms, our search for a digital health platform or vendor, and then how we plan on leveraging tools like AI, Decision Assist, ChatGPT at Intermountain here. So the first topic I want to talk about is a technology loan library. And with each of these technologies, before we dive into them, I want to talk about what was the problem that was identified that we wanted to solve with the technology. And so the problem we identified here, so when I was hired on 3.5 years ago, there was a perception, and I'll back up just a sec. Intermountain has many different clinics. So we, in rehab, have acute all the way to home health, over 50 different clinic sites and locations. And there was a feeling that the Intermountain's in the dark ages when it comes to technology, that we're not meeting our care providers or our patients' expectations with technology. And, hence they hired me, and I was coming on board with Stephen's team. There was also a lack of coordination or communication, and really when something was successful, that was not, or technology was successful, it wasn't being shared across the system. There was just issues. Simply put, our providers didn't feel like they had access to what they needed or wanted. And, you may think, well, let's just buy everybody the tools that they need. We didn't even have the ability, with that many clinics and that many sites, we didn't even have the ability to say, let's get you the basic tools that, we can all agree that you probably should have. And so throwing money at the issue would have been nice to fix the problem, but not a realistic one. And so as we talked with different providers and explored different ideas, we came up with, well, could we pilot something that we're calling the technology loan library? So what this was a repository of appropriate technologies. Now, this had to be devices that could be moved from clinic to clinic, didn't require any special formal education or, special training to use, that any OT, PT, speech could check it out from the library and start using it with a patient without any risk of harm. And what we found is that this actually was a very popular idea. Now, again, if money was no object, we would just buy all this equipment for all our clinics and, that problem solved. But that wasn't the ability. So we found that clinics really like to be able to check items out. We've got a total of 66 different items in the library, and that continues to grow. We've been running it now for 2.5 years. We have items like augmentative alternative communication, environmental control or access devices, ADL or activities of daily living devices for our OTs, functional electrical stimulation, therapeutic exercise, which we'll talk was very popular. So things like a Fit Light trainer, little LED pucks that you can set up to do activities with patients, or mobility engagement tools. And what was really nice is that clinics could check things out. Now, in this library, we check them out for 30, 60, sometimes 90 days, depending on how popular an item is. And so clinics could try it out. And if they found, hey, this is really successful, we really need something like this, then they could go and buy it. Because again, the library is temporary. They don't get to keep it, but they can at least try it and say, is this something that we should invest our limited funds into purchasing, and find out that lesson that, yeah, this is as great as we thought it was going to be, or no, let's try something else. And, no harm, no foul. They don't have to do that. The other benefit that we've been finding too is that clinics, now, because they have access to all these different technologies, they'll get a random patient in that they wouldn't normally have that equipment for, even if, it's a patient with a unique need for their clinic or their location. And when that happens, they can go onto the library and they can look for different devices that may meet that clinician or that patient's unique need. So it's been serving those two primary purposes, but a lot of clinicians are using it. We have over 1,400 care providers at any given time, all who have access to it. And I ship things in and out. We have an internal mailing system, so it doesn't cost anything to ship because that's all provided by Intermountain Health. Just to give you some numbers, this is, we started this in 2021 and continues to grow by utilization. So in 2021, we had 80 total checkouts for the year. We had a few less items, but then in 2022, we had 114 individual checkouts. And then on 2023, we're on track to potentially, if the trend continues, over 200 checkouts for the total year. So as you can see by month, it's really popular and things are going in and out. And it's cool to see, this is the next slide here, who's checking things out, because I keep track of everything that goes in and out, who's checking them out. Probably no surprise, OTs who tend to deal a little bit more with technology, they're checking out 44% of the time. Then managers of different clinics who want to try things out from a manager level, then followed by PTs. Speech, but they're the smallest group here. So this is probably not surprising to anybody, and it's certainly not surprising to me, but good to know who's checking things out. Community-based or CBC is community-based care, so our outpatient clinics, even home health is grouped into there. So they're the heaviest users, and then followed by our inpatient rehab facilities at 30%. Acute, which, that doesn't surprise me. We'll see how that changes over time. They've been a little bit slower to adapt, but their patients are much quicker turnaround. Other little point or data point that I want to talk about here is what's most popular. So let's say if you're like, this sounds like a good idea, or maybe something we could leverage in our setting. What's been popular? So I track what's going out and what's the category. By far, therapeutic exercise, or TheraX, so things that engage a patient in mobility and movement, has been the most popular. So those items are constantly going in and out. Things that work with access with the environment, surprisingly, have been quite popular as well. Other includes tablets and then ADLs, so like adapted silverware, functional electrical stimulation. So I think this is kind of helpful if you are thinking, maybe invest in a couple of quality therapeutic exercise devices if you're thinking of starting a loan library or something similar. So a final note on a technology loan library. This was a real win across the system. And so it was a low risk. We invested, I think about $20,000-$30,000 in starting this loan library, and the benefits have been really, really great. Subjective feedback from care providers is that it's changed their perception quite a lot with a minimal purchase on our end. Another benefit is vendors have learned about the technology loan library, and they've actually donated equipment to the library. And so a good success story of that is we had a vendor with an adapted sling, which I thought was cool, but he donated a set to the library, and then I just started checking it out to different clinics. They didn't request it. I just said, hey, I think these are kind of cool. You may want to consider using these. Just sent them out to their clinic. Didn't cost us anything because it was donated. And I'll tell you, every clinic who's tried those adapted slings have ended up purchasing one. They've told me after about a month, and I've said, hey, it's about time to bring these back. They've said, no, don't take them. Let us buy a pair because we use these every day. So it's been really nice for us to have this system. We've had multiple other items donated to the library. And that sounds really intriguing, to a vendor to say, hey, 50 different clinics who will have access to, and I only have to donate one, sometimes two. But it's not all, roses. There are drawbacks and things you need to consider. You need to have a staff that manages the process, which that's what I do. Shipping can be costly. We have our internal shipping, so you need to take that in consideration if you don't have that built internally, that will be very costly over time. And you need to have enough clinics to share the cost. This works because Intermountain, again, we have over 50 different clinics sharing this one library. If you had only a couple, that may not make as much sense. And key things to remember, knock on wood, I don't know why I keep saying this, but we haven't lost any devices. We use Apple AirTags to track these. And many of these devices, especially in outpatient, go home with patients. Between visits, therapist will send it home. We've got an AirTag, and that's what this picture is over here. I can see where any device or item is at any time. So I'm sure we're going to lose something eventually, but I would have thought we would have lost a lot more. So overall, a net win. This really worked and addressed the issue that we had within the constraints that we had with limited funds and being able to do that. And leveraging, I could talk about the whole process of the check-in, check-outs, but leveraging simple tools, we gave and we changed the perception. That's what I'm most proud about, is that when I go to different clinics now, they may not have everything they want, but their perception of, does Intermountain Rehab have technology or adequate technology, has changed. Okay, moving on, because this is the topic that I'm actually most excited, and I could talk for hours about these two. So I'm going to try to make it as concise as possible to get you excited, and then perhaps we can connect offline or can generate ideas in your own. So these two tools together are just amazing. But what's the problem that these are addressing? So at Intermountain, up until somewhat recently, we were using pen and paper to collect a lot of data across our system. So a prime example that we're going to talk about here is audits. We had sent out a PDF or a printable form, and then managers were printing out that form, and then they were writing out and doing the audits that way. We were asking others to do that audits that way. We're going to talk about, but that was one example. We were collecting data in other ways using pen and paper. And as you can think, we lacked central location. Like, where was that data? Well, it was in a piece of paper with a manager who was doing audits, and that wasn't being shared across the system. There was no real way to analyze it from a system-wide. There's just a lot of downside to doing it via pen and paper and siloing that information across our system, as well as issues with standardization. So we sent out that original form of, here's how we do audits, but then, a year later or 6 months later, we tweaked that original form, and I'm sure we tried to send it out to all our different managers, but did they really get that update? And were they printing that, or were they still using the old form? It was just chaos. So not great. And recently we've been able to leverage these tools. So this is where these come in. So if you're not familiar with Microsoft Forms, this is similar to if you've used SurveyMonkey, Google Forms, but it's part of Microsoft, and Intermountain Health here, we leverage Microsoft tools. So those are the ones that I'm most familiar with. But let's see if I can get here onto the right. Microsoft Forms is basically just a way to create a way to collect data. So we're going to talk more in detail, but this is an example of a form that I have here where I want to standardize the audit process. And so I create the types of questions, the type of feedback that can be provided on that question. So it standardizes data collection to be able to do it in a uniform way, in a controlled way. That's hopefully pretty familiar to most of you. The second one will be a lot less familiar, but is really exciting. It's kind of the secret sauce of all of this. And that's a tool called Power Automate. Now, I'm not familiar with Google or other platforms that allow this. They may have it, but I'm not as familiar. And what Power Automate does is when it's triggered, it will automate a process that you've preset. And we'll give a specific example, but when a very popular one is when I I want to say every time a new form is submitted for this form, every time someone submits a new form and hits click and submit, I want you to do something with that data. I want you to grab that data. I want you to put it in a spreadsheet. I then want you to send out an email with certain data in it. That all sounds complicated, but it's not really. But it automates and it takes that process of data collection, organization, and then the next steps and completely automates it in an easy way. Because that's, if you had enough technical and software knowledge, you've been able to do that before, but it really makes it accessible and easy to do. So using these two tools, we've been able to go from pen and paper siloed information to really improve data collection on, I've already mentioned audits, but we now use these tools to track our Con Ed process. So we can track who's submitting for what, where they're from, what are the next steps, and all of this is fairly automated. And those who are reviewing just need to follow the process. It's reducing the amount of effort and time someone has to do to track and say, hey, is this progressing? Is it not? That is now all automated. I'd love to talk. Oh, yeah, we can leave that in there. It's because it's like having cool superpowers to be able to leverage in there. But Acute is using this with I thought this was an amazing use case. Our Acute managers are having therapists at the end of their shift just scan a QR code with their phone, which then takes them to a form. They answer 3-4 questions. It takes them 30 seconds. But they're then mining that data to then track daily productivity, needs, demands, and that all gets dumped into a spreadsheet that our Acute managers are then tracking to say, okay, how do I need to flex more resources here? It's beautiful because it takes minimal effort on the care providers that are submitting the data, but has a huge benefit for the managers. Again, I could go for an hour on each of these and really show in depth. We've used it. I'll just mention real quick another one that might be of interest to this group is we've started piloting the reported outcome measures or ROMs with our OTs. And before we went through the effort of building this in our ROMs platform and piloting that there, we used Forms and Power Automate to start collecting data, that the same data that we want to put in ROMs. But we did like a mini pilot where we tried, hey, what if we ask for this data and what if we do this? And it was really nice because we could change on the fly, which we did. We said, okay, let's collect this data for a couple of months, look at it. Okay, yeah, this is kind of getting where we want to go, but let's change. Let's ask these questions now, let's do there. So it was really easy to change and adapt without putting in the heavy resources of doing something formal. So you can do small pilots, you can do all sort of stuff. But let's, because I want to be, hopefully everyone is following along. And I know I'm talking really fast, but I get really excited. And I want to be able to cover everything that I have in here. Let's give a specific example. And I'm actually going to show you what it looks like so that it'll make more sense. So you start with a standardized form. We're going to do an audit right now. Now, this is going to be fake data. But as I've shown previously in here, this is the audit form that we have in here. And again, it's really nice because if we want to add a question to our audit process, I can just go in there and I can add a new question at the, put it anywhere where I want to inform. If we want to tweak how we're asking a certain question, all of that is easy and within my power to do. And then it's going to be dumped into, this is our master. Now I'm blocking any PHI. So there's nothing in there, but these are all of our audits that we have had just for this year. And so what this is going to do is when I submit this new audit, it's going to mine that data, put it in here, and then I'll show you what next steps that we've had it do in there. And then this is going to show up automatically. So in this use case, let's going to add a new audit for AltaView. So this is a pivot table. This automatically updates whenever a new form is requested. But in here, and not to pick on AltaView, they're just the first group that's coming up in here. this is aggregating all the data for all the audits for this year. So you can see out to view here, they've had a total of 28 audits. They've only passed 75%. But if you break it down in here, their initial audit, they only passed 65%. And then with their follow-up audit, so this is just aggregating both the initial and follow-up audit. But you can see here on their second audit round of audits, they did much better. They're at 91%. So let's say in this instance, I'm going to do a third audit process. So let's go over here to our audit form. Let's say it's their third round. So in this mode, I'm now an auditor. I'm going to select that this is the third audit. I'm going to create a quick fin, test patient name, because I'm just going to delete all of this. Treating therapist is Kevin Bacon, because why not? I would select their actual manager, but because we're just testing it, it's going to go to me. This is where all the test ones go. Click it on Alta. Yep, it's Alta View. So I'm now just creating, this would be real data, but for our instance here, we're doing, so I'm asking these audit questions. Was the cert signed? I'm going to say no, and it was greater than 30 days. No. Total treatment time, 45 minutes. We're going to go there. I'm just going to speed through this because what I want you to see is how it takes and mines this data and what it does with it. So I'm not going to do a full audit. We're only going to do a partial audit. We're just going to do there. Now, as soon as I hit submit, it's going to automate that process. Oh, it's going to go over here. Sorry. So I go ahead and I hit submit. Now this is where our Power Automate is. And why is this? This is in my way. Sorry, y'all. So this is my background Power Automate. This is what's grabbing and mining that data. Microsoft Forms is one component, and then you have Power Automate. Sometimes it takes seconds, sometimes upwards to 30 seconds. Let's let it run again. All right, so this is telling me, hey, 24 seconds ago, someone submitted something new, and that flow ran successfully. Well, what did it do with the data? Well, when that form was submitted, it went and it grabbed the data, and we have a master spreadsheet. So I went ahead and said, hey, we keep a master spreadsheet from all previous years up to, the current data. So I went ahead and said, send the data there so we have a master backup of all the data. But then what it did next was it went to our current year data, which is our 2023 spreadsheet, which is this. It analyzed the data, it put it in that spreadsheet, and then it had a decision tree in here. It said, did it pass every audit question? In this instance, no, it didn't. It actually failed. And so it says, okay, it was a failed audit. What are we going to do with a failed audit? Well, if it's a failed audit, we're going to send out an email to the manager and include all the things that failed and send them a email saying, hey, you need to take care of these items. And then even another step or layer on there, it's going to look in there and say, were any of those failures critical? Because we have critical audit questions in the audit form. We have non-critical. And so this is looking out for, were any of those critical? If they were, it sends an additional email saying, hey, by the way, these were critical and you need to fix them if you can. And then that generates a task list. And so hopefully this is a lot of detail. And again, I could talk on and do a whole presentation just on this. But what I want you to see in this is that there are layers. So instead of someone manually going in and saying, hey, a new submission is formed, oh, was it failed, and analyzing that data and then following up with the manager, sending them an email and saying, hey, can you try to fix this? This is an issue. It's all automated. No one has to do it. It's just doing it. It's on its own. You tell it what you want it to do, and then it does it. And it doesn't take a whole lot of, once you understand the process and the tools here, it does it. We also have in here, it creates a task list. So this was a critical failure, and then it creates a task that manager has a certain deadline to fix. and to be able to go with. So going back here, so this is our spreadsheet. If I go here, as soon as I refresh this, or just if I were to close it and follow it back up, now that data is now showing up for me. So I can see, okay, well, here's our third annual audit. Now, we would have more than one. We would probably have a whole round of audits for the third audit, anywhere from 17 to 11. But for this purpose right here, you can see, all right, in the third round, what is their percentage? Well, because there's only one, they failed 100% of the time. But I can go and I can also build out dashboards that show, well, what were they failing on? Well, if we go in here and see in their second annual audit, well, nobody really failed in this critical question. They didn't fail in that one. Where are the failures coming from? Well, looks like they were failing at skill time and untimed codes, which is a critical failure in the audit. And so I can look in there and see, all right, that's something that we can work on. And so I don't have to organize any of this data. It just automatically puts it into the spreadsheet where it needs to go. And now I can do the same thing. Like if I wanted to look into Intermountain Medical Center, I can look and see what was their initial audit, what was their follow-up audit. Thinking back to what we were talking about at the beginning, if you were still doing this with pen and paper, there's no way that we're going to be able to, all that data is siloed. And so using Microsoft Forms, using Power Automate to mine, collect that data, and then send off. I closed down my Outlook because I didn't want to be, but if I were, I would look and see, I actually got an email informing me that an audit had failed and that the items that I needed to follow up with. So that's an example. So again, we're using that Microsoft form, standardize how we ask the questions, how we do it. Power Automate then takes the data, it filters it down, it does everything that we told that we want it to do with it, and then puts it into that spreadsheet, organizes it, does beautiful pivot tables. And like Stephen mentioned at the beginning, all of this was low cost. If you have Office 365 account, you most likely have access to Power Automate, Excel spreadsheet. I mean, this is just Microsoft Forms, Power Automate, and Excel spreadsheet all working together to really improve our audit collection process. And we've been able to make educated decisions on, okay, where do we need to work on? Where, as a system, are we failing? Where in geographical locations do we need to improve? It's made our efforts in educating and training our therapists much more potent and work a whole lot better using simple free tools that right now that we have it set up, it's just doing its thing. So a lot of great things that it did for us. Brad Dalton at APTA did a poster on this, and it won for the Technology Special Interest Group Award, and I think rightly so. This is just really a great effort and high impact, low cost. We standardized the data that we collected. We put it all in one central location. We had automated analysis like you saw in there. It just gets put in pivot tables, and we can automatically see how things update, where they go. We sent those automatic alerts to managers, so they were getting an email with a task list saying, hey, you need to address this, and this is where your care provider audit failed. We could track and see, are we improving? Are we staying the same? Are we getting worse in areas? It was really efficient. Didn't add any extra time to the auditors, but it really had a good impact on the managers and the care providers because it aggregated that data to be able to see it. And it was flexible. I can make a change to the audit process tomorrow, today. And now any new audits from that point forward will automatically have that change. There's no way, there's no sending out an updated form. Okay. So love Power Automate and Microsoft Forms. We use it for everything. Hopefully that gave you some ideas of how you may consider using that in those tools. So shifting to the last two technologies that I want to speak about today. And so these ones, as I mentioned, we don't have a final solution or something that we've leveraged, but I want to talk through our thinking and how we're addressing these issues. So looking at digital health platform, that includes telehealth, remote data collection tools, RTM processes. When we use a group in Rehab, and in particular, the group that I lead that looks at this sort of stuff, when we thought about, well, what problem are we trying to fix? It was really hard to immediately come out. There's a lot that we want to do with telehealth, that we want to do with RTM, but other than everybody's talking about digital health right now, right? Like digital health's really hot right now. We didn't have a clear idea of what exactly are we trying to fix with digital health. We know we need it. We know everybody is moving towards it and has a lot of interest in it. But what are we really trying to do with digital health? And so it provided us an opportunity to step back and say, okay, we're not just going to take some vendor and to just start, playing around and play with it. We're going to take a step back and we're going to analyze, what do we want to do with digital health? And is that going to then lead us to the right solution that we need for us? So this is an opportunity to talk about my favorite framework when I think about technology, and that's the SET model. And we'll talk about what that stands for. But it really helps me when I'm focusing on how am I trying to solve a problem. And if technology is going to be involved, how do you go from we have a problem, what is the problem, to okay, this is the appropriate technology to throw at it. So the SET, or the S in there, is student, but you can think of it a client, but it's who's the users of the technology. Who's going to be utilizing any potential solution or tech that you want to throw at it. And so in this instance, for digital health, we knew Rehab was interested in leveraging a solution like this. But as we talked with other departments at Intermountain Health, we understood that we're just one of many. And so MSK, which is closely aligned, MSK Sports, but what we ended up finding was that there were 16 other departments, and it continues to grow, who actually were looking at digital health and through kind of the similar lens that we were. And so we wanted to include them in our search, because, why have a solution that only works for us when potentially we could find a solution that worked for 16, 20 different departments as well. So we identified other interested departments who would be end users. We thought, okay, in those departments, who are the actual users or care providers specifically using this tool? And so that would include rehab staff, OT, PT, speech. That included physicians, nursing, care coordinators, more. But we took a minute to focus on, okay, who are the primary users? What departments are there at? So that included the student or the persons. If you're an OT, this may sound very familiar to like PEO, person, environment, occupation framework, because it is. And so after we looked at who's using it, we looked at, well, where is this going to be, the environment in which this solution would be utilized at. And so we learned, hey, it's not going to be just inpatient. It's not going to be just outpatient. It'll include all those areas, home, in the community. So any solution we need to be able to work within those environments, and with those types of patients in those environments. This includes surgery patients, rehab patients, community dwelling patients, all of the above. So once we understood who was using it, where they'd be using it, then we were able to brainstorm, okay, what do we want to do with this? And so we were able to formulate, and these were the 5 areas that really we could all agree upon, right? You have 16 departments with a variety of care providers, but we were able to determine, hey, the core things we really need out of digital health are these 5 things. Standardized data collection, ability to track patients over time, integrated in EMR. And so we've used these 5 core tasks or needs to then guide our process. And so this slide just quickly talks about, we used Microsoft Forms, and we sent out this questionnaire asking many different questions. And vendors responded back to that. And then we were able to take that list of 16 vendors and narrow it down to just 6. Okay, who are we actually going to have present? Who are most aligned with, because we built that questionnaire based on our tasks and our 5 critical areas that we want to address. Now that's where we're at currently. In the future, we're going to have vendors present, and in particular how they're going to fix the problems that we've identified or address those. And then Microsoft Forms again will have participants on our end grade each vendor on their presentation, and then that'll guide us to, okay, hopefully we know the 1 or 2 people who are actually using it. So sorry, we're still very much in process of finding it. We've been able to identify the areas that we want to have leverage in and work with, but hopefully in a year or 2 or 3, I'll have more of a, hey, this is the vendor or the platform that we've leveraged. These were the tasks that we wanted to accomplish. Here's what we actually were able to make a leverage on. I'm excited to see what happens, but we've been very slow, very methodical over the past year and a half looking into this. All right, so last, because I want to leave enough time for questions. Decision assist. This includes AI, ChatGPT, Intermountain, or GPT, AI. These are all buzzwords that I'm sure many of you are hearing about. It's exciting. I mean, just think, nobody knew really what ChatGPT was 6 months ago, and now it's everywhere. There's some exciting stuff coming out. And so at Intermountain Health, I want to share some of the different tools that have been emerging. Again, these are nothing that we have fully implemented, so I can only talk about what we're hoping to do, areas that we're investing in. But really, we want to utilize these tools to be able to make following best practice easier. How can we make our care providers confident, comfortable, and ensure that they're following best care practices and getting them the information they need to make the right decisions? How can we train? We'll talk about this in just a second. Really, that training and onboarding and making sure therapists and providers stay competent has been a big, not an issue, but something that we've really worked on in the past, but it takes a lot of effort. And so how can we leverage these tools to make that easier? How can we reduce time on tasks that they don't need to spend as much time, right? How can we do more with less? And how can we improve outcomes? Of course, we all want that. And being able to leverage those. So let me set this up because I want to talk about the example of doing decision assist, which is one of the ones that Stephen Hunter, he's leading in here. But previous work that Intermountain has done has shown if you train therapists on best practice guidelines, you can reduce the failure to progress. So this is a graph here, that blue line that's dipping down. That's the percentage of our patients that we see for a condition and their failure to progress or to meet a certain standard for success. And so when we've leveraged intensive training and retraining and more training and then following up on that, we've been able to get that number down and low. But it took a lot of effort, a lot of time, a lot of training. I feel that we can, and that this is where these tools come in, is we can leverage many of these tools to hopefully make it easier to train therapists, to get them, to nudge them, and make that following the care practice guideline the path of least resistance. And so there are tools like Sevilla Health. We've looked into them. There are others. Stephen Hunter's been leading this work. So there are tools that are out there that have AI kind of decision assist, the smart tools that can build into that workflow to nudge a care provider and say, hey, we've noticed this. Are you thinking this way? Or can you, did you remember to do this critical piece? That's not annoying or making it more cumbersome to do the charting. So we've explored Sevilla Health. Again, we're not partnered with them. We've just explored them. We're still working into it, and it's difficult. These images over here on the right, I put those on there more because it's really confusing. We've tried to map out how do you get this to work, to send nudges that are not overbearing. What data are we pulling in? I mean, we've got lots of ROMs data that can really inform and help if we can give real-time or near real-time prompts to the care provider. So we're still trying to, how can we leverage the tools that are in there? And that's kind of anticlimactic to say, not yet, but I think we're getting there. I think we're getting there with, AI and flows. I think give it a few more years and there will be some really robust and great tools for us to be able to leverage all that data that we have now, and really be able to focus in on make sure that we're helping our therapists and make it easier for them. But there are tools currently, and I want to quickly talk about DAX, which is by Nuance or Dragon Dictation. And this is a tool that Intermountain Health is using, but it's with physician providers. It's not with Rehab yet. What this does is you train it to listen, and then you train it on how you document. And so in Rehab, we would train DAX that, during a Rehab eval, we ask these sorts of questions, and that data goes into this portion of the documentation. And so what it's doing is it's listening to the patient, the care provider, and then after it listens to the entire interaction between the two, and then at the end, it writes up a note based on the directions that you've given it, and then the care provider goes, reviews, make sure it's accurate, and then can sign off on it or add to it. I've used this. Intermountain Health is where I see my primary care physician, and it's really great. The physician just puts out the recording device right there. And the physicians I have talked to have said it's saved a lot of time and is really nice. So this can be an effective way to start reducing the amount of time our care providers are having to document, because let's be honest, that is likely their least favorite part. I don't know, I've met any care provider that looks forward to documentation. So that's the ability to leverage AI to reduce that portion of it. And I want to briefly talk about AI and pre-generative. So ChatGPT. Intermountain's building a sandbox called Intermountain GPT, where without risk to PHI and other issues, we can start playing with ChatGPT. So I'll be able to talk about that more in the future. I think that has huge potential to save on certain routine tasks. So I'm running out of time. I want to give enough time for questions. I tried to talk as fast as I could, and hopefully you all felt it was interesting. Really, really quickly, please reach out to me. The Academy of Research, APTA's Academy of Research, has identified these shifts in technology as a real critical need in the next 5 to 10 years. And so they've set out some goals. I helped co-lead this with Bob Latz. And we really feel like we're at a pivotal time where we need to help give caregivers skills and resources to adapt, to be able to utilize the tools, right? Take for just example, ChatGPT. How is that going to change how we provide care? And now ChatGPT 6, 7, they're going to be able to get good information about their certain condition. And how is a therapist then going to play their role when we're no longer the purveyors of good, solid data? How do we interact with the technology that can give better clinical advice than potentially we could? It's kind of scary, but also really exciting to think about. So we've set some goals and some leverage areas that we want to work with, being able to increase therapists' ability to adapt and utilize technology, understand the data it provides, be outcome driven, and then how we disperse that. And it's really complicated, really fun. If that is singing to you and you're like, yeah, I want to be involved in the APTA work group doing that, reach out to me. But anyways, all right. I left us 5 minutes for questions. Whew, thank you.
Take a deep breath, Kevin. That was great. You spoke great. Absolutely love your passion. Several questions have come in, but for those of you who have questions for Kevin, if you want to type those into the Q&A, we can get those answered for you. So the first one, kind of early on, was what are your top products that get rented out the most often?
Yeah, so surprisingly enough, it's some ADL. Our OTs really love this. These are constantly going in and out. So Liftware is one company, but you can look, there are others, but these are adaptive silverware. And so patients will often try these with patients. You've got the Steady, which is an anti-shake. This one just helps with range of motion. That's for the ADL and our OTs like this. For our PTs, they've really enjoyed the FitLight. So let's see, Blaze Pod is a competitor. You know, I'm not recommending one over the other, but these are constant. I can't remember the last time these were in, but these are those little LED lights. You can set them on the wall, set them on the floor, but you set them up to do timing or cognitive tasks, or, I mean, the sky's the limit. These are for high level trainers, but our PTs love using these in the gym. So those are the two that come to mind. VR was very popular. We had some VR headsets, both for pain management. So one that was kind of more of a relaxing, soothing, and then VR, just consumer VR, that was very popular. That was going in and out a lot. But yeah, if anybody wants to come, I've got a whole spreadsheet that tracks, and we can talk the data and all that. Just reach out.
Okay. Yeah. Next question. The tech is great. However, how did you work with your rehab teams to embrace tech, learn how to introduce tech to patients that may be against using tech due to distrust or anxious about HIPAA or security?
Yeah. And that's hard too, right? You've got the people that are adapting, and you know, I love people and say, oh, I'm not techie, so you know, I'm just going to avoid it. That's a good question. It's been nice. I think them knowing that they can come and talk to me. And I try to get out to the different sites. I haven't been out to every site, you know, it's 3.5 years and I still haven't been out, but going in and just talking and knowing that I'm there as a resource and not judging or forcing, right? You can't force people to use technology. That's just asking for abandonment and ill feelings. So allowing them to ask questions and not feel dumb or judged, that's been, I think, what's been most successful. I don't know that I have a good idea for the others, you know, when it comes to PHI, just building that trusting relationship and they know that there's someone that they can talk to.
I think we have time for one more. Why would Intermountain contract with a virtual vendor instead of building it internally?
Ooh. We've talked about that. It takes a lot to build a virtual vendor. If you're talking about like the digital health, we could, but yeah, I don't see it happening. Unfortunately, there's a lot that needs to go into a lot of investment, and so at least from what I understand, with our digital integration teams, they would rather partner with someone that's already got built up that infrastructure and resources, because there's a lot more than you might think that goes into it. You know, our perception is, oh, just build an app that does this, duh, it's easy. And it's like, rarely is it ever that simple.
Hey, well, thank you so much, Kevin. I think this was great, and I'm sure you'll have a lot of questions. Your love and passion for technology really came through. And so I think you gave a lot of people a lot of things to think about. So thank you and have a great day, everybody.